Dr. Ravi Patel joining us from the Comprehensive Blood and Cancer Center this morning, talking about the latest on lung cancer because it is Lung Cancer Awareness Month. Good morning, Dr. Patel. Good morning. A lot of new treatments out there, and an exciting one you guys are talking about. It's a clinical trial, and it's well in its advanced stages. You're teaming up with UCLA to study this drug that could combat lung cancer, right? Correct. Talk to us about how it works.
You know, it's an exciting drug because one of the ways cancer cells grow in your body is your immune system just doesn't recognize them. So people have been struggling to see how you can have the immune system recognize and attack cancer cells. So the exciting thing about this drug is that the cancer cells are evading the immune system by covering themselves up with a protein which acts like a shield. So what this new drug does, it stimulates, it blocks this protein so the cancer cells cannot evade the immune system and can be attacked.
I think we have some video to show this, and let's talk about this because it has been effective, you say, in melanoma, right?
Yes, just yesterday we see, as we see in the cartoon here, the T cells are an important part of the immune system, and they need to attack the cancer cells. So the cancer cells are being attacked because they are, that PD-1 protein is sort of eliminated by this new drug. And in melanoma, 50% of the tumors have this protein. In melanoma, there's a high amount of it. So just yesterday, there was new information that about 70% of the melanoma patients can have a response with this new drug.
So it works well with melanoma. You guys are hopeful, very hopeful that it will be just as high with lung cancer.
Very much so.
Yeah, interesting stuff. And let's talk about the CyberKnife, because you and I talk about this all the time. You know, the rudimentary treatment has been chemotherapy, which kills off everything, including the good cells and the cancer cells, the bad cells. CyberKnife goes in there and pinpoints just the bad ones.
Very targeted, and it says CyberKnife, but it's no knife. It's just a very targeted beam, and it has a sub-millimeter precision. But one of the huge benefits is older patients can just not go through lung surgery. So this then attacks and targets the cancer in older people without any surgery approach. They can walk in and walk out for the treatment.
And not be cut open and everything and have all the recovery time with it. And let's talk about the latest in early detection of lung cancer. How are you guys detecting it earlier?
So one of the newest things is, and just approved by Medicare for the coming year, is the low-dose CT scan. So it takes less than a minute to do it. Much less time than a chest x-ray, but at the same time, a 20% reduction in death rate for cancer, lung cancer. The right kind of patients are 50 to 74 who have smoked for at least 15 years.
Okay.
Tremendous progress.
Yeah, making a lot of progress, not only in treatment, but also in detecting it earlier. The earlier you get there, the quicker you can treat it.
The better the chances of a cure.
Dr. Patel, as always, good to see you here on this Wednesday morning.
Thank you.
All right, we're going to take a quick break. We'll be right back.